Gather and clean required examination equipment. You will need a tendon hammer. Perform hand hygiene. Introduce yourself to the patient and check their identity by confirming their name and date of birth. Explain the examination and seek verbal consent to proceed. Consider if a chaperone is required. You will need to ask the patient to walk, stand, sit, and lie supine during the examination. Make sure the area to be examined is adequately exposed, whilst also taking care to maintain privacy and dignity. Assess the patient for any distress and ensure they are well enough for you to proceed. Ask if they have any pain, clarifying the location. The examination follows a gait, speech, eyes, upper limbs, lower limbs structure. Both sides should be compared when examining the limbs. Observe gait for stance, stability, and symmetry.
I'd like you to walk to the center of the room, turn around, and come back.
Look for wide-based, unsteady, slow, or staggering gait. Note if the patient is falling to one side. Test heel-to-toe walking test and note any unsteadiness.
Now the next thing I'd like you to do is put one foot in front of the other, like so.
Position your hands on either side to prevent any falls.
That's fine. And stop there.
Perform a Romberg's test and note a positive test if the patient fails to maintain balance.
Put your 2 feet together. Close your eyes.
During the test, stand ready to support the patient if needed.
Open your eyes.
Romberg's test is a test of proprioception and is used when gait and heel-toe walking is deemed normal. It is not a test of cerebellar function, but a test of balance and coordination due to proprioceptive factors. Test for dysarthria by simply talking to the patient. Note slurred, jerky, explosive, or staccato speech. Ask the patient to repeat 46 West Register Street, or British Constitution, or Baby Hippopotamus.
46 West Register Street.
Test for impaired smooth pursuit, nystagmus, and saccadic eye movements.
I'd like you to look at this torch and then follow it with your eyes.
Test for rebound phenomenon.
Now turn them over. Close your eyes.
Check tone, looking for hypotonia.
If you put your arms down, open your eyes. Just want to test your tone. I'll have to go to the other side.
Test coordination with the finger-nose test, looking for past pointing and intention tremor.
With your index finger, touch my finger, touch your nose, touch my finger, touch your nose, touch my finger, touch your nose. And we'll do the same with your left hand. Touch my finger, touch your nose, touch my finger, your nose, my finger, your nose.
Further test coordination with rapid alternating hand movements, looking for dystiadocokinesis.
If you put your left hand out like this and your right hand onto it and turn it over as quickly as you can. And we do the same with the other side. Put your right hand, left hand on it and turn it over as quickly as you can. That's fine, thank you.
Check tone, looking for hypotonia.
I just want to roll your legs.
Test coordination by performing the heel-to-shin test.
With your left heel, touch my finger, drop it onto your shin and rub it up and down. That's fine. And do the same with your right heel. Touch my finger, drop it onto your shin and rub it up and down. That's good. Thank you.
Check reflexes, looking for pendular reflexes. Clean the examination equipment and perform hand hygiene. Thank the patient, then allow them to dress. Explain your findings to the patient and complete appropriate documentation in the clinical record.